very good evening to all of you. And you all know that autism spectrum disorder is a very uh, basically it is a very undiagnosed problem that is prevailing in the society. So as we know that today is the World Autism Awareness Day, so we are celebrating this special day as a autism spectrum disorder by holding a national webinar. And I'm very privileged to having with you all. And with this, I'm going to present this topic on autism spectrum disorder concerns and management. So we will start with some famous personalities with autism spectrum disorder. जैसा कि हमको पता है कि शुरुआत हमारी किसी पॉजिटिव पॉइंट के साथ होनी चाहिए, रादर कि हम एक डिसऑर्डर के बारे में बात कर रहे हैं। तो कांटों की राहों को हमेशा फूलों की सेज समझकर चला हूं, मुश्किलें कितनी भी हों फिर भी मुस्कुराते हुए बढ़ा हूं, क्योंकि मैं एक बचपन से ही संघर्षों में पला हूं। अक्षम नहीं सक्षम हूं, इस संसार का महकता उपवन हूं मैं। So these are the famous personalities who have defeated the autism. Like Charles Darwin, you are all aware, Bill Gates, Albert Einstein, and this is a Paralympic swimmer. So what is autism? So autism is a developmental disability that typically appear during the first 3 years of life. So इसमें 3 चीजें हैं, बिहेवियर, सोशलाइजेशन एंड कम्युनिकेशन की बेसिकली प्रॉब्लम हमें जो नोटिस होती है वो ऑटिज्म में बेसिकली देखी जाती है। सो जैसा कि वी आर सेलिब्रेटेड लास्टली social work in a diverse field. So here also diversity in autism spectrum disorder at the 3 level: intellectual level, communication level, and behavioral level. So coming to the history. So coming to the history from 1897, Handley Maudsley noted the group of young children with mental disorders. After that, in 1908, Theodore Heller term defined infantilis, subsequently disintegrative psychosis or Heller syndrome. Heller syndrome, my friends, I just you all are maybe aware that Heller syndrome is a subtype of autism spectrum disorder. So in 1911, Eugene Bleuler given the term autism in an article on schizophrenic negativism. And who are the key person in autism who has changed the scenario of autism? And that is the Leo Kanner. Leo Kanner has coined the term early infantile autism in his observation of a group of children who displayed unusual patterns of behavior before the age of 30 months. His criteria for diagnosis were essentially social aloofness and elaborative repetitive routines. So in 1944, Hans Asperger given the term autistic psychopathy, similar syndrome but with more language and communication skills, indicating a stable personality disorder marked by the social isolation. In 1966, a case of Rett syndrome was firstly reported by Andreas Rett. So coming to the definition, as I have already described that autism is a pervasive developmental disorder, is a heterogeneous group of neurodevelopmental syndromes characterized by the wide range of impairment in social communication and restricted and repetitive behaviors. So according to DSM-5, there are basically 5 discrete disorders under the umbrella called autistic disorder, Asperger disorder, childhood disintegrative disorder, which we also know as a Heller syndrome, Rett syndrome, and pervasive developmental disorder, NOS. So when we are going to Asperger syndrome, we found that in the Asperger syndrome, there is an impairment in social interaction, restricted and repetitive and stereotypical behavior. And here the sex ratio, we found male are more affected with Asperger syndrome rather than female. Seizure disorder uncommon in Asperger syndrome and less chance of family history positive in here Asperger syndrome rather than when we compare about the autism disorder. So autism and CDD, when we compare that, in CDD we found that impairment in social interaction, impairment in communication, restricted, repetitive, and stereotype patterns of behavior, and childhood disintegrative disorder outcome worse than autism. Autism and Rett, impairment in communication we found in both, impairment in social interaction, IQ severe, MR to normal, unusual patterns of developmental loss, characteristics of head growth decelerates, female are more affected than male, as we have seen that in Asperger male are more affected than females. Here females are more affected than males, and the poor outcome we found as a poor prognosis in Rett syndrome. So criteria for autism spectrum disorder. So we have a basically in social communication criteria. These are criteria by DSM-5. So there are, we have to if you want to you have to say about the autism. If some person is having autism, you have to focus on these three criteria, like deficit in social emotional reciprocity, deficit in non-verbal communicative behavior used for social interaction, and deficit in developing and maintaining the understanding social relationship. So in restricted and repetitive behavior criteria, there are a major four criteria we found: that stereotypical and repetitive motor movement, use of object or speech such as simple motor stereotypes, like lining up toys. ये बच्चे जो हैं चीजों को लाइन से लगाते हैं, आप देखोगे. फ्लिपिंग ऑब्जेक्ट्स, इकोलोलिया, चीजों को बार बार एक ही जैसा रिपीट करते रहना. नंबर 2, इंसिस्टेंस और सेमनेस, इनफ्लेक्सिबल एडहेरेंस टू रूटीन और ritualized pattern of verbal and non-verbal behavior such as extreme distress in small changes. यूजुअली देखा जाता है कि अगर इनके जो आप लाइफ स्टाइल में अगर थोड़ा भी चेंज करते हैं तो ये परेशान हो जाते हैं तुरंत. डिफिकल्टीज इन ट्रांजिशन, रिजिड थिंकिंग पैटर्न, दे वांट लाइक एज अ सेम greeting rituals, need to be take same routine or eat same food every day. This is the third, highly restricted fixated interests that are abnormal in intensity or focus, such as strong attachment or preoccupation with unusual objects. As you have all heard about autism, that they are more attached with some unusual objects. It is like any type of toy or some utensils or anything else, excessively circumscribed by your preservative interest. And these are 4, hyper and hypo reactivity to sensory input or unusual interest in sensory aspects of the environment, such as apparent indifference to pain, adverse response to specific sound or textures, excessive smelling or touching of object, visual fascination with light and movement. तो यूजुअली देखा जाता है कि इनके साथ अगर आप इन्हें कुछ खाने को देते हो, ठीक है, ये कोई भी चीज को टच करके, स्मेल करके, ठीक है, उसके बाद ही उस चीज को यूज करते हैं, चाहे वो खाना हो, चाहे वो कोई टॉय हो, या किसी चीज को, वॉल को टच करते रहना. ठीक है, तो दीज आर द कोर सिम्टम्स डोमेन associated with medical features, like we found that social anxiety, OCD, ADHD. ADHD is very common, we found with the autism, intellectual disability, and sometimes we misjudge autism with the OCD. So these are the core symptoms domains. Associated behavioral symptoms that may occur in autism spectrum disorder: disturb in language development and uses. So what are the associated behavioral symptoms? That disturbance in language development and uses. In the first year of life, you found that typical pattern of babbling may be minimal or very absent. Second, children with autism spectrum disorder may exhibit speech that contains echolalia, as I have described earlier. Both immediate or delayed or stereotype phrases seem out to be context. These language patterns are frequently associated with pronoun reversal. What is the pronoun reversal? इसमें usually जैसे क्या होता है कि sometimes the child used to say his name rather than कि मुझे लेना है, मुझे खाना है, वो बोलेगा कि मान लो किसी का नाम रोहन है, he will say रोहन खाएगा, रोहन को ये चाहिए. ठीक है, रादर वो ये नहीं बोलेगा कि मुझे चाहिए या मुझे खाना है. So pronoun reversal. Intellectual disability: about 30% of children with autism spectrum disorder has intellectual disabled range from the intellectual functions. So irritability, we found that irritability includes aggression, self-injurious behavior, and severe temper tantrums are there. Instability of mood and affect, response to sensory stimuli. Children with autism spectrum disorder have been observed to over respond to the some stimuli, like under respond to other sensory stimuli. आप लोगों ने शायद माय नेम इज खान देखा होगा, तो शायद उसमें आपने कैरेक्टर शाहरुख खान का देखा, उसमें वो येलो रंग के साथ बहुत ज्यादा उसका सेंसिटिविटी थी। मतलब कई बार ऐसा लगता है कि वो किसी आवाज के साथ या किसी लाइट के साथ बहुत ज्यादा उनको रिस्पॉन्स करने में उनके साथ प्रॉब्लम होती है। हाइपर एक्टिविटी एंड इनअटेंशन जो बहुत कॉमनली ऑटिज्म में देखा जाता है, और भी बहुत बड़ा दुर्भाग्य है कि व्हेन सम टाइम हमारे पास पेशेंट आता है तो वी मिसजज द ऑटिज्म विद ADHD. So this is a very common phenomena we found with autism. And number 8, precocious and savant skill. This is the positive skill we found with the autism. Like some individual with autism spectrum disorder that have a precocious and splinter skills of great proficiency, such as prodigious rote memories, calculating abilities, usually beyond the capabilities of their normal peers. Usually we found that इनकी memory, they have a very savant kind of memory, मतलब इनकी बहुत sharp memory होती है, इनके अंदर जो skills होती हैं वो आप पाओगे कि normal बच्चे से बिल्कुल beyond एक आपको अलग सी skills नजर आएगी. Number 9, insomnia. Insomnia and frequent sleep problems among children and adolescents with autism spectrum disorder estimated to occur in 44 to 83% of school-aged children. So this is the prevalence from 1975. It is 1 to up to 5,000, and now in 2010 its calculation 1 out of 68, means after the 68 child, one is suffering with autism. So you are seeing that how much the rate is increasing day by day. So when we talk about the sex distribution, we found that autism spectrum disorder is diagnosed 4 times more often in boys than in girls. This is the source by Autism Research Foundation. This is the differential diagnosis by which we misjudge autism, like social and pragmatics communication disorder, childhood onset schizophrenia, intellectual disability with behavioral symptoms, language disorder. Sometimes usually when we are in OPD, parents came to us with the main chief complaint of the language, that मेरा बच्चा बोल नहीं रहा अभी तक, इतने उम्र का हो गया, ठीक है, वो बोल नहीं पाता. तो अदर कंसर्न, द सोशल कंसर्न एंड द लाइक जो उनका आई कांटेक्ट है, जो उसका सोशल कम्युनिकेशन पैटर्न है, मतलब उसका जो लोगों के साथ इंटरेक्शन है उसका बहुत ज्यादा फोकस नहीं, रादर देन की लैंग्वेज पे ज्यादा फोकस है. एंड कंजेनिटल डेफनेस और हियरिंग इम्पेयरमेंट, ये बहुत ज्यादा कॉमन देखा जाता है कि जो इस तरह के बच्चे होते हैं उनका बेरा असेसमेंट ASSR के लिए हम बहुत ज्यादा प्रेफर करते हैं, रादर कि हम उसके डायग्नोसिस मिस कर जाते हैं. सो साइको सोशल डेप्राइवेशन, ठीक है. सो फ्रॉम कंसर्न टू इफेक्टिव ट्रीटमेंट, what is the important when you are noticing and developing concern, discussing with the others and getting the accurate diagnosis, that will give you the effective treatment. In this slide I want to say that sometime when the parent came to us, they discuss with their some friends and family members and they say that everything is fine. So don't follow, these are wrong line. Sometime if you find any kind of problem having features of autism or having features of any developmental kind of disability, you have to be find the right path to the service care providers or to approaching the mental health professionals or health professionals. So with this I have edited one book on autism spectrum disorder. It's not disability, it's a different ability. Yes, it is a different ability rather than a disability. So you can also refer this book. With this, always unique and totally interesting, sometime mysterious. That is a full form of, really a full form of autism. So today is a World Autism Awareness Day. So thank you with this. Thank you so much.